Assalamu alaikum wa rahmatullah. The article of this week is titled Occurrence of Vertical Root Fractures After Epica Surgery, a Retrospective Analysis. It's a retrospective cohort study published in the Journal of Endodontics by Von Arx in 2021. So, as vertical root fractures are one of the most frequent causes of tooth loss, mainly of endodontically treated teeth, however, very little data was available on the occurrence of vertical root fractures following the Epica surgery. So, the aim of this study is to analyze the occurrence of vertical root fractures in a cohort of teeth that were treated with Epica surgery. So, moving on to the methods. Patients charts from 864 patients with 1,058 teeth treated with Epica surgery were retrospectively evaluated if a vertical root fracture had occurred after surgery. The following possibly influencing factors were analyzed: the sex, age, type of treated tooth, primary or resurgery, the technique of root end preparation, and time point of vertical root fracture diagnosis. Also, the endpoints were either tooth extraction or last follow-up. For the results, the overall rate of vertical root fractures after the apical surgery was 4%, which is 42 out of 1,058 teeth. Among these 32 teeth, 33% were mandibular first molars and 26% were maxillary second premolars. The most frequently affected root was the mesial root of mandibular first molar, which is 28%. And with regard to the study parameters, the significant differences of vertical root fracture rates were only observed for the type of tooth treated. So, in conclusion, based on the present findings, apical surgery seems not to result in a higher rate of vertical root fractures than the conventional root canal treatment. So, in my opinion, as the study has a retrospective nature, which make it more susceptible to missing data. Also, the other thing is that there is no any information or a recording of the condition of the tooth before the surgery, as it might has a post or if it was retreated, which would affect the outcome of the treatment.